Good morning and welcome to the public briefing of the Standing Committee on Social Development. My name is Jane Wayala Armstrong and I am the MLA for Mofi-Klitschou Region and Chair of the Standing Committee on Social Development. I will now ask members in the room to introduce themselves for the record and followed by those online. And we'll start to my left.
Good morning. My name is George Nearsu. I'm the MLA for the Mackenzie Delta. Welcome.
Good morning. Danny McNeely, MLA for the Sahtu region.
Good morning. Kieran Testard, MLA for Range Lake here in Yellowknife.
Good morning. I'm Shauna Morgan, MLA for Yellowknife North.
And those online?
Good morning. My name is Cheryl Yakalai. I'm the member for the Det'anchogh. Thank you.
Okay. Thank you, members. Today we will receive a status update from the Joint Territorial Nursing Council on Internationally Educated Nurses. Please note this meeting is being live streamed to the Assembly's social media. I would like to remind all members and witnesses to direct all questions and comments to myself as chair and to wait to be recognized before speaking to help us have a smooth meeting. I will now pass it over to Deputy Minister Doty. Please proceed with your presentation.
Good morning, Madam Chair and committee members. It's a pleasure to be here this morning. I would like to thank you and the committee members for the invitation, for the opportunity to discuss the work that the Joint Territorial Nursing Council has been doing towards internationally educated nurses in the NWT. I am pleased to be joined by my colleagues from Health and Social Services, Sarah Shorakowski, Assistant Deputy Minister of Programs, and Sheena Wasuda, Director of Territorial Health Services and Chief Nursing Officer for the NWT. Madam Chair, we have been told that there are internationally educated nurses living within the Northwest Territories who want to work as registered nurses in the health and social services system. In response, the Joint Territorial Nursing Council, which is comprised of nursing leadership from the Department of Health and Social Services, the three Health and Social Services Authority, Aurora College, the College and Association of Nurses of the Northwest Territories, and Nunavut, have been working to better understand the barriers being faced and to explore options to reduce the barriers and challenges. Today's presentation will provide context on who internationally educated nurses are, the challenges they face in joining our health system, and the work underway to mitigate these barriers. We will outline the current regulatory framework, share insights from other jurisdictions, and discuss options being explored to support the integration in a way that meets the unique needs of the Northwest Territories. This is an important conversation about workforce sustainability and ensuring safe, quality care for residents. Madam Chair, with your permission, I would like to ask the Chief Nursing Officer for the NWT, Ms. Wasuda, to lead us through the presentation. And following the presentation, ADM Shorakowski and Chief Nursing Officer Wasuda and I will be happy to take questions.
Yes, please proceed.
Good morning. Today I will share how public concerns about internationally educated nurses, or IENs, prompt an action in the Northwest Territories. I will walk you through what we learned, what's feasible in our context, and the next steps that we're taking. So what we'll go through in this presentation, I will provide an overview of what an internationally educated nurse is, share how public feedback led us to act, share what we learned from other jurisdictions, and outline what is next for the NWT. An internationally educated nurse is someone who completed their nursing education in another country outside of Canada. Education programs vary across countries, different curricula, clinical experiences, and scopes of practice. Cultural norms and language differences can also affect integration. These differences are linked to the expectations of the nurse's role in the country that they are trained in. This does not mean that one system is better than another, but what it does mean is that integration requires planning and support to ensure safe, effective care. The public told us that there are IENs living in the Northwest Territories who want to work as registered nurses but face barriers. At that time, we didn't know how many IENs were here or all of the challenges they faced. We took action by reviewing legislation and regulatory requirements and engaged the Joint Territorial Nursing Council, which is comprised of nursing leadership from the Department of Health and Social Services, the 3 Health and Social Services authorities, Aurora College, and the College and Association of Nurses of the Northwest Territories and Nunavut. This council provides leadership and strategic direction on nursing matters under the guidance of the Chief Nursing Officer of the NWT and reports to the Minister of Health and Social Services. The JTNC also created a working group to gather data and develop recommendations. So what we learned. Across Canada, other jurisdictions have introduced supports, such as creating a single entry window to support IENs who are interested in working in their jurisdiction that supports their journey through their processes. Some have developed education programs that provide education to address gaps, practicums to gain experience, and laboratory components to practice skills. Others have tailored orientation and onboarding supports that are long-term and continue beyond initial hire, supporting the integration into the health and social services system. These approaches work, but they require significant resources and long-term commitment. For the NWT, we need solutions that fit our size and our capacity. Here's a snapshot of some of the options that were looked at. Starting with supervised practice programs. These are programs that allow IENs to gain clinical hours under RN supervision, typically through partnerships between the regulator and health authorities. Currently, those who are taking these programs must leave the territory to complete their required practice hours. Establishing a program in the NWT would require significant funding, new positions, specialized training tools, which we currently do not have, and given the ongoing health and human resource challenges and our fiscal realities. Our priority remains keeping doors open and lights on, and within the work of the Health and Social Services System Sustainability Unit underway, we need to be cautious about adding new programs before that work is complete. Putting in a supervised practice program would put extra pressure on our nursing workforce. Frontline nurses are already mentoring students, new grads, and new hires all year round. Adding IENs into that mix would stretch them even further, and many are already experiencing burnout and fatigue. Additionally, any program would need tailored orientation to reflect the unique context of the NWT, including our commitments to cultural safety, person-centered care, and team-based approaches. Bridging programs. Bridging programs provide education and practicum experiences to address gaps in training and competency, enabling IENs to become registered to practice in Canada and to integrate into the Canadian healthcare system. While these programs offer structured pathways, creating one in the NWT would require significant capacity and resources to meet diverse educational gaps. Aurora College currently has limited capacity. Finding placements for existing practical nurse and registered nursing programs has been challenging. Any future consideration would need to ensure alignment with our system's plans and strategic directions. Our current pathway in the NWT requires that IEN applicants must either hold active registration in another Canadian jurisdiction and meet practice hour requirements of 1,125 hours within the last 5 years or 450 hours within the past 2 years. The 450-hour component is new as of April 2025. Or They must complete a competency assessment through the Inspire Global Assessments pathway. Both of these options, the applicants must also pass a recognized licensing exam. These requirements protect the public. It ensures that all nurses meet entry-level competencies. Inspire Global Assessments identify gaps and guide next steps, which may include additional education or bridging programs. In some cases, IENs may need to travel outside of the NWT for education at their own expense, including costs for travel, accommodations, childcare, and tuition, especially if the program is not available online. The Joint Territorial Nursing Council noted in its exploration of potential interventions to reduce barriers for IENs in the NWT that we did not have data on how many IENs are in the NWT, and if there were more challenges that they are facing other than practice hour requirements. To respond effectively, we established the Territorial IEN Working Group with a mandate to gather data, identify barriers, and to recommend potential solutions. The Territorial IEN Working Group membership includes representatives from the Department of Health and Social Services, the 3 Health and Social Services authorities, CAN, which is the regulatory body, Aurora College, and the Department of Finance, Human Resources. We launched a survey in April and May this year to learn how many IENs are here and what challenges they faced. During this time period, CAN introduced 2 important changes. They added the option for 450 Canadian practice hours within the last 2 years, and they initiated their contract with Inspire Global Assessments. These changes may have made a real difference for IENs, and we are working closely with the JTNC and CAN to monitor the impacts. Our next steps is that the survey results are currently being analyzed, and we expect to have them available in early 2026. The working group is developing their recommendations for the JTNC endorsement in the new year. Collaboration with stakeholders will continue as we explore creative solutions that fit our unique context, reflecting the values and strategic directions of our system, cultural safety, person-centered care, and team-based approaches. Thank you.
Thank you for the presentation. And I will now ask members if they have any questions. Mr. MLA McNeely.
Thank you, Madam Chair, and thanks for the presentation here. As I was taking notes here, I noticed page 7 of the presentation here really explains what I was thinking here on results from the demand. And I kind of note you're gathering the data for the demand of nursing in the NWT and the barriers and recommendations. So that survey is underway, and it's going to be presented by recommendations in early 2026. So I look forward to that. As we all know that we've got a huge problem out there, but to measure what size of a problem, maybe some of the recommendations or some of the information in your next presentation, which I hope you can schedule that presentation in early 2026 to the committee, is how many nurses do we need, and by which region? Like I represent the Sahtu. Take the Sahtu, for example. How many nurses do we need for that area? So once we identify the demand and need, and we know how to help fix that problem. So that's my recommendation, to give some detail on your next presentation to committee. And you had mentioned some hours to be accumulated, 1,125 hours over the past 5 years. is this part of your survey or research into the licensing aspect of nursing? Thank you, Madam Chair.
Yes, Deputy Minister Duty?
Yes, thank you, Madam Chair. I'm going to refer that question to ADM Chorokowski.
Mr. Kowski?
Thank you, Madam Chair. Thanks for the question, and appreciate your comments about looking forward to the results of the work and the need to be some of the details you'd like to see in future briefings. In terms of looking at the regulatory requirements, the current Nursing Profession Act is quite new. It hasn't been in place for very long, and so we're not currently looking at making changes to the regulations or to the legislation. The practice hour components are set by the regulator, which is CAN. And they've, as my colleague mentioned, they've recently made some changes to create some more flexibility in those practice hour requirements. So the JTNC is not looking at those impacts as part of the survey. It was more to collect information on the IENs that are out there, because when the IENs are out there and they're not working in our system and they're not registered with CAN, it's very difficult for us to have a sense of how many of them are out there and what is their background, because we don't have any data on them because they're not our employees necessarily and they're not registered. So we really did that to kind of put it out there to let IENs tell us about who they are, where they are, what their experiences are. The regulatory piece that we're looking at from the hour perspective is definitely in the fact that that change was introduced while we were beginning this work with the survey. And so we're interested to see how that change may impact some of the IENs that are out there. And so we do intend, because that change happened while the survey was out, we do intend to follow up with IENs that provided their contact information and had consented to us following up with them for more information if need be. So we do intend to do that piece of work too, to try to track how that might be making a difference.
Mr. McNeely, are you satisfied with the question? Because I think, I don't think they answered the questions. So,
Thank you,
okay.
Madam.
Go ahead.
Thank you, Madam Chair. Yes, I took in what you said, and you had mentioned the next question was going to be around legislation, what we need as a government to accommodate these individuals with their certification. And you had mentioned that you don't plan to change any legislation. Can I ask why? Thank you.
Okay. Deputy Minister Duty?
Yeah, Madam Chair, and thank you very much for the question. So I think just to frame it, like, so currently there hasn't been anything that's been highlighted yet that would require us to look at changing legislation. However, in the presentation, you would have heard that they are assessing what those barriers are. And if legislation actually ends up being a barrier, then, and I'm assuming that will be a recommendation that's coming out of the joint work by the team so that we could advance it.
Thank you. Ms. Morgan, you have MLA Morgan, do you have a question?
Thank you, Madam Chair. So you talked about the option of doing the Inspire assessment as well as passing an exam. So my understanding, I could be wrong, correct me if I'm wrong, that was a pretty recent solution that was reached, or an option. I wonder if you could speak more about that in terms of what does that involve from the system's point of view? Like, does that take resources? You know, does someone have to, from our system, have to like administer the exam, supervise it, or the assessment? I guess there's an assessment and an exam. And then from the nurse's point of view, how long does that take? Is that just a one-day thing, or does that extend it over a long period of time? I just wonder if you could describe more what that Inspire assessment and then the exam actually involves. Thank you.
Deputy Minister Duty?
Madam Chair, I'd like to refer that question to Chief Nursing Officer Wazuda, please.
Yes, please proceed.
Okay. Hi. Thanks for your question. I'll start with the part about the exam. The nursing exam is the national exam that all registered nurses take that, signifies that we meet entry-level competency and that we are ready to practice. So that's a component that all nurses have. So IENs need to take that exam as well. And then with Inspire Global Assessments, your question is likely more appropriate for the level of detail that you're looking for CAN, but I can give you a bit of overview. So Inspire Global Assessments is a company that has knowledge about curriculas in other countries, and they use that knowledge and the IEN's personal background, and they assess what their education was against Canadian standards. And then the individuals do activities in which they have exams and other types of skills-based activities where they're assessed to see if they meet those competencies. And so that contract is a really important measure that supports an understanding of whether the individual has the competencies that they require to safely practice in the context that they're looking to work at. So for example, in some countries, nurses might not have had education, experience, or exposure to pediatric care, for example. And so if an individual has come into Canada and they're looking to practice, pediatric experience and education and competency is an expectation of the Canadian healthcare system. And so Inspire will be able to identify that gap, and they'll be able to make a recommendation about where that gap's education should be either taken, or what kinds of hours or what activities would be required to bring that, to close that gap, essentially. Thank you.
Okay. MLA Morgan, do you have a follow-up question? Yeah, please proceed.
Yeah, thank you, Madam Chair. And we are going to hear from CAN, I believe, next week, so we can ask them more details. But do you happen to know, does the company take care of everything themselves in terms of the assessment, or does it require our nursing staff managers to, be involved in doing the assessment or implementing it? And do you know if the company comes here to do the assessment, or if the nurse is required to go somewhere else in Canada to do this assessment? Thank you, Madam Chair.
Deputy Minister Duty?
Yes, Madam Chair, I'm going to actually refer that to the Chief Nursing Officer, Wazuda.
Yeah, okay, please proceed.
Thank you. Sorry, I forgot that part of your question to begin with. But yes, no, the health and social services employees and the health authorities are not a part of this process. This is a process that happens prior to the internationally educated nurse receiving their certification, so they're not in our health system, providing care or anything along those lines. My understanding is that this assessment can take place, portions of it can take place virtually, and portions of it may be required in person. Again, CAN will have the most details about that, but this Inspire Global Assessments is really a tool that gives us confidence that when individuals have completed all of the activities, that they are entry to practice and that they'll have a good footing once they come into our system.
Okay. Next, I have MLA to start.
Thank you. Thank you, Madam Chair, and good morning. Thank you for the presentation. This is something that we've been interested in for a while, so it's good to see work being done. I also note that CAN has changed the licensing or moved IENs to the general currency practice requirements that all nurses take, which allows them to get on equal footing, but the assessment pieces I think are important, and also finding ways to streamline that I think are important as well. So my first question is, there's an organization to the previous line of questioning called the National Nursing Assessment Service. This is accepted by all, their reports do much the same thing, but they're accepted in all jurisdictions except the territories and Quebec. So why, what is the reason for that? Because it seems like in all, basically the rest of Canada, there's one service. It's a proven service. It does these assessments, it does this work, but we're not party to it. Can you explain why? Thank you.
Thank you. Deputy Minister Duty?
Yes, thank you again, Madam Chair. I'm going to refer that to Chief Nursing Officer Wazuda.
Yes, please proceed.
Yeah, thanks for your question, and that's a keen observation. But yes, the National Nursing Assessment Service is used in other jurisdictions, and we do only have the contract, or I should say has the contract with Inspire Global Assessments. And it's my understanding that these two assessment services are just two companies doing a similar activity. And so one of the benefits that I would just say from my view is that Inspire Global Assessments training centers are located in Western Canada. And so CAN has made a great decision in finding a solution that is as close as possible to the Northwest Territories.
Okay. Melanie, to start, do you have a follow-up question?
Yes, different topic, but all related. Anyway, that's good. That makes sense. Yeah, because if it's not a regulatory body or there's not an impediment, it's just a vendor choice, essentially. That's good to know. Okay, going to the general currency of practice requirements. So this varies across jurisdictions. Ours are, 400 hours within 2 years, 450 hours in 2 years, or 1125 in the past 5 years. Now, in other jurisdictions, such as Ontario, and the reason I bring up Ontario's example is MLAs have risen on this before as kind of one of the areas we would like things to go, because they're a bit more, bit less onerous on our requirements. They only require practice within the last 3 years, I believe. And then the other example would be Alberta, and I'm not sure the details, but they don't have like a hard and fast hour requirement. And many nurses that we've had conversations with are going to Alberta for certification and the regulatory thing. So what would it take, because I'm not interested, because this is a technical brief, I'm not going to ask your position on that policy, but what would it take to change that so we could move to a more, a system where you wouldn't need a hard and fast quantity of hours, but you would just need to prove recency. And then in those jurisdictions as well, if the regulators, in our case, can notice gaps, then they would have our requirements through bridging programs. But I think the upfront of just saying, if you've been working in this field, we'll accept you, would be preferable for a jurisdiction that is desperate for nurses and struggles with recruitment and retention. Thank you.
Thank you. Deputy Minister Duty?
Yes, thank you, Madam Chair. And I will refer this question to Chief Nursing Officer Wazuda, but before I do that, I just want to highlight that, we do have to make sure that people meet the standards to be able to work in our health system. So on your last point about being desperate, and maybe I misunderstood, but taking anybody, but I'll refer that to Chief Nursing Officer Wazuda to talk about the technical aspects. Thank you.
Okay. Please proceed.
Yeah, thank you for your question. So the 1,125 hours in the past 5 years and the recently added 450 hours in the past 2 years of Canadian practice is a requirement for all registered nurses in Canada. So this is a currency of practice. That's what those hours provide us. And so this is the way that in the Northwest Territories CAN ensures public safety. This is a mechanism that tells us that you have had currency of practice, that CAN is able to say, we don't require you to take extra education because you've had these clinical experiences and adequate hours within these two timeframes. So actually the 450 hours in the last 2 years is more recent currency of practice than 1,125 hours in the past 5 years. So it's a critical measure for practice safety. So there is no plans to necessarily request changes to these requirements.
Thank you. Next, I have Melanie Nursu. You have a question?
Thank you, Madam Chair. One is the, looking at other jurisdictions and attracting nurses and retaining them. What is the GNWT and the other agencies doing to streamline the process of attracting nurses and keeping these nurses, these internationally and nationally educated nurses within the NWT? You know, what can we do today to attract them? It's something the general public wants, you know, to meet the needs of the residents of the NWT. We need to attract and retain these nurses within the NWT. And how fast can we streamline these processes? Thank you, Madam Chair.
Thank you, Deputy Minister Duty.
Yes, thank you, Madam Chair, and thank you very much for the question. I think when it comes to the recruitment and retention of healthcare staff, not just nurses, there's a whole bunch of activities that are important. So to attract people to the north and to have them stay here in the north and work in the north. And there's a whole bunch of activities within the system, as we've been briefing probably over the last couple of days about some of those things, about some of the changes in the system. They actually also act as recruitment and retention tools to improve the work environment of our staff. The people strategy, which has not been released publicly yet, is part of that recruitment and retention. And there's a briefing coming up shortly related to that to give some more insight on some of that work. So that is part of it. But I just I don't want anyone to think that we're just waiting for the people strategy. There's lots of different initiatives that are geared at trying to attract healthcare professionals to the territory and to retain them here. So thank you very much.
Thank you. MLA Nurse, do you have a follow-up question?
Yes, thank you, Madam Chair. How does the NWT compare to other jurisdictions in terms of attracting these educated nurses? And, you know, are we competitive based on being federally funded? Is it population? Is it the remoteness of the communities? Is it other factors that, you know, that we bring these nurses to the NWT and keep them here for an extended period of time? You know, it's something that is needed in the smaller communities, is needed in Yellowknife for the Territorial Hospital, and, you know, how do we compare to other jurisdictions? Thank you, Madam Chair.
Thank you, Deputy Minister Duty.
Yes, thank you, Madam Chair, and thank you very much for the question. So I'm confident that the work that the collaborative work that's ongoing related to internationally educated nurses will recognize barriers and help us identify solutions, which will provide some opportunity for us to specifically perhaps target internationally educated nurses more as a pathway to increase our capacity. So that work will hopefully be at a point to be able to present more back here early in 2026. As far as how we compare to other jurisdictions, I don't have that data here, and we don't have that information to be able to present back. Some of the larger jurisdictions that do have capacity have different programs on how to move internationally educated nurses into their system, and I think the work of the team that has been shared by both the ADM and the Chief Nursing Officer will identify with the other organizations that are participating, will help us identify those pathways so that to bring more internationally educated nurses here. Thank you.
Okay. Thank you. MLA Yakalaya, do you have a question?
Yes, I do. Thank you. And thank you to the presenters for the presentation. I really really want to stress the importance of cultural awareness and the barriers to language for people in the Northwest Territories. A lot of the small communities we're dealing with predominantly Indigenous people. So in your cultural awareness, like, because you have to bring this to the nurses once they get integrated into the system, the INS, how are you gonna, how is that gonna happen? I'd like to know how that, how you plan to do that. Thank you.
Okay. Thank you. Deputy Minister Duty?
Yes, thank you, Madam Chair, and thank you very much for the question. So I'll just make some general comments, and then I'll refer to ADM Chorokowski to answer. There is currently within the system some onboarding education and tools for staff that work in the healthcare system that they have to take. And as we briefed last night, there's been a really concerted effort on cultural safety and anti-racism within the department, with the team that has been stood up to do the analysis, but work with our Indigenous governments and our staff on trying to raise a level of knowledge and also practice for services in the territory. But ADM Chorokowski can certainly add more to that, answer that question. Thank you very much.
Okay. ADM Chorokowski?
Thank you, Madam Chair, and thank you for the question. I would just like to highlight that we agree how important that is. You know, certainly when we're looking at any nurse coming into our system, whether they're coming from elsewhere in Canada or whether they're an internationally educated nurse, the context in the NWT is different than perhaps, you know, just what they may have experienced elsewhere in Canada or in other countries. Even the way our system functions, I think we all understand, is a bit different here than it might be in southern jurisdictions and larger centers. And so that sort of tailored orientation is really critical. So making sure that the IENs have the competencies to practice in Canada is one thing, but also making sure that they have the competencies to practice in our system and in our small communities, and make sure that they you know, are aware of and integrated into our system in a way that enables them to practice in culturally safe ways is really important. And so I think, you know, there's no probably one answer to how we're doing that. I think there's a lot of work in the system underway. There's the primary healthcare reform work. There's the work of the team, the cultural safety and anti-racism team, and the training that staff are going through. Of course, anybody coming into our system is subject to that. But specific to IENs, that's also part of the work that the JTNC will be doing as they review the results of the survey and seek to identify recommendations, as CNO Wazuda noted, that are specific to our unique context. So I think I would just say I think we recognize that, agree with the need and the importance of that. I think there's lots of ways that it's already happening in our system, and of course, specific to IENs, we're also looking for specific strategies and creative options to support them in that as well, so that they're successful and so that we're able to provide the best care to residents in small communities. Thank you.
Thank you. MLA Akalaya, do you have a follow-up question?
Yes, I do. Do we have cultural safety and anti-racism standards for the NWT? Thank you.
Deputy Minister Duty?
Yes, thank you, Madam Chair, and thank you very much for the question. I guess the short answer is we don't have standards per se. We have training that has been developed in consultation with Indigenous governments that we use, you know, to provide education to individuals coming into the system, but we don't have specific standards on that.
Thank you. I do have a question too as well. And then further to what my colleague, MLA McNeely said, you know, I would like to know too as well, how many, you know, how many nurses do we need in NWT regions, communities? Are we at the capacity? You know, I would like to know that answer. And another one too is that recognized licensing exam. So didn't hear anything, but you know, what is the success rate on that? Because I know people coming in, their education, their background is different to the Canadians, so I just want to know what's the success rate on that? A lot of them, yeah, thank you.
Madam Chair, thank you very much for the question. So as far as what's required, how many nurses in each region, and that's data that we can provide back to the committee in writing. Like, we should be able to get that together for you really quickly on positions and vacancy rates. That's predominantly held within the authorities. And the success rate on the examinations, that's also data that we'd have to go seek. I don't have that with us today to be able to provide.
Okay. And when they do that, I would like to see from where, where are we getting most of the nurses or that are here? I would like to see that too as well. But it's something that we can ask for after too. So we are open for second set of questions, starting with Mr. MLA Tester.
Thank you, Madam Chair. So just to clarify my earlier points, I'm not saying race to the bottom here. I'm saying there are two there's Ontario and Quebec have different requirements as far as I understand, and I am not an expert, so I am absolutely willing to learn and be corrected, but Ontario uses recency of practice rather than minimum hours. Minimum hours play a factor into that. As I understand it, Quebec uses continuing education and has hour requirements of that. The point I'm trying to make is, yes, I know most Canadian jurisdictions do it one way. Is there a way we could look to do it differently if it's going to give us an advantage over other jurisdictions for recruiting and retaining nurses? And I would say if Ontario has a different minimum hour requirement, I'm pretty sure nurses are regulated and registered in Ontario, so it's not necessarily a race to the bottom if we change those practices. So that's probably a conversation we will have with CAN, but other jurisdictions have adopted expedited pathways for IENs from designated countries that have similar nursing systems, so the UK, New Zealand, Australia, the United States. Alberta has recently identified countries like the Philippines and India as well, with a special exam that allows expedited process, and then Ontario has a labor market agreement or labor mobility agreement that allows you to quickly move between jurisdictions within days rather than the normal process. So those, I don't know where the line is between CAN and U. I think the labor mobility is probably a ministry decision, whereas perhaps the kind of not favored countries, but I guess they are, but like places that we have a long history with, and we can feel confident that their systems are compatible with our own. Can we roll those out? Is that something you're looking at? Is there a way to put those in place? Because it would be a heck of a lot easier, especially like I think of the Philippines, where we have a great contingent of Philippine nurses and more people coming in to do those jobs. And they do great work in the Northwest Territories and have a fantastic community here as well. And have become, some of our hardest working citizens. So how can we pull this off here? Because it seems like those would be great pathways to allow more flexibility, cut through some of that red tape, and get them practicing in the Northwest Territories. Thank you, Madam Chair.
Deputy Minister Duty.
Yes, Madam Chair, thank you, and thank you very much for the questions and the information that's provided. So I think the regulatory pieces squarely fit within CAN, but they're part of this joint working group. So I think there's certainly opportunities to have those conversations and on how that we can maybe expedite some of those processes from the regulatory pieces. And then again, as part of what was briefed by the chief nursing officer, some of that work in the review is what's the capacity of our system to manage as we get them in to get that practicum hour. So I think there has to be some unique solutions that fit us. So I really appreciate that, and I think that's the things that they're actually looking at. So, the start point was how many IENs do we have within the territory. They're doing that as the assessment of what are the barriers to implement those folks into the territories, but also what are the different pathways from different countries, and then we can leverage what we've learned from our other jurisdictional partners on some of the paths that they've taken. So I really think everything's on the table. I think we'll probably be in a better place in the next, somewhere in the next 3 months to identify what those are. And then we have to have that tough conversation about what can the system manage to be able to support them in territory, because then it's a different pathway if we are looking for partnerships with other jurisdictions to train IENs to bring back to the territory. So I think there's, I think today we're not in a position to answer some of the questions because some of them belong to CAM, but I just want to be assured that the system is working together to try to find the best way to augment our nursing capacity. Thank you.
Okay, thank you. MLA Tester, do you have a follow-up question?
Yes, thank you. Well, if it's a capacity issue, like if it's a staffing capacity issue, is it possible to identify some financial resources for it as well? Like, we've developed incentive programs in the past for, like, I know our priority needs to be Northerners first, so, and that's always gonna be my priority, and we have a great SFA program for that. But if we had like a bursary program to cover your Inspire assessment, I think they do that in some other jurisdictions as well, to incentivize IENs to apply here. I mean, you need the other places in place first, but I guess throw everything at the wall and see what sticks, because I think if you look at this space, and again, I'm not an expert, and this is very complex stuff, so I'm not purporting to be that, but if you look at the space, there's a lot of movement in trying different things and trying different pathways and programs and incentives to solve this national nursing shortage. And if it is like a human capacity thing, I don't want to overwork what we've already got. I think CAN does a great job, however, and I think the fact that it pools both Nunavut and Northwest Territories probably helps with that, because there's a larger pool of expertise to go off of. But when it comes to our own government's resource, even finding other ways that's not just the human resource factor, but financial resources as well. I know there's no money, all that kind of stuff, but healthcare is so important. And if we can even find a small incentive, it's better than no incentive. And I think that's something I want to see, I guess, when you come back in 26, the kind of things that would I think be important to this committee would be those kind of tangible things, right? Not more like, we took a look at it, it's complicated, we're doing our best, but there's still more work to be done. If you can come back with some very clear ideas that can be implemented either in, even a supplementary estimates, like I'm not saying be prepared for the budget, because that might be too tall an order, but we need to see something tangible, so we can have some assurances that this is moving forward in a direction that's actually going to see results at the end of the day, because I think this is a really important dimension of a nursing solution. And that's why CAN has recently adopted, like, changing these hours and doing the work themselves, because they've recognized that as well. So let's find a way to help within our space to support CAN to do that work and make the Northwest Territories a more attractive destination and I guess Nunavut as well. I mean, that's another thing. Maybe we could talk to Nunavut and say, we share the regulatory body. How can we pool joint resources to make this happen, or adopt an expedited pathways program that's shared by both jurisdictions? We need something clear that we're moving forward, and that is often challenging at this committee, right? We have a lot of recommendations and work that's planned and planning documents and strategic plans, but the real actions are what's going to change things. And I think you are well positioned to bring forward some meaningful actions. Thank you, Madam Chair.
Thank you. Deputy Minister Duty?
Yes, thank you, Madam Chair, and thank you again for the question. So I think the results coming out of this work with recommendations, if there are financial requirements to required, like, they'll go through the appropriate process to be able to secure funds if they're not already readily available in the system. But I would like to refer to the Chief Nursing Officer, Wazuda, to actually talk a little bit maybe about the work that's going on, so that it gives you some better understanding of the collaboration across with Nunavut as well. Thank you.
Please proceed.
Yeah, thank you, and thanks for all of your thoughts. You are on the right track. Those are exactly the things that we're talking about at the Territorial IEN Working Group that we asked them to look into. So folks on my team participate in a federal provincial table that discusses internationally educated healthcare providers, and we have these type of brainstorming discussions and information sharing tables. And the chair of the Territorial IEN Working Group, she's on that specific planning table. Myself, as the Chief Nursing Officer, am also at Chief Nursing Officer federal provincial tables, and we have discussions regarding that. And recently, both the Chief Nursing Officer of Yukon and of Nunavut and I have all discussed that we want to get together to talk about what is on our line of sight with regards to what we can do as small jurisdictions with what we have and how we can be creative. So all of the things that you're talking about are exactly those that are on the table, and that both the working group is looking at and I myself am looking at as the Chief Nursing Officer for our jurisdiction. So thanks. That is what we're planning to bring back in the new year. Yeah.
Yes, thank you. MLA Morgan?
Thank you, Madam Chair. So a few minutes ago, like the ADM was speaking to the importance of the fact that the nurses that work in the Northwest Territories need to be oriented specifically to this place and cultural safety. Even those that may have been trained in other parts of Canada require sort of significant orientation and training to be able to understand how to appropriately work here. And it occurred to me that could also well describe the challenge that we're seeing with having to bring in agency nurses to fill gaps, in that there isn't an opportunity when people are just here for a short time to really get people oriented to the local environment and cultural safety, and so that ends up placing a huge burden on the staff working around them to try to sort of, hold their hand or keep mentoring or coaching or explaining. And I understand that we haven't brought agency nurses into the smaller communities, mainly or maybe exclusively at Stanton, probably due to that rationale that, it wouldn't work to send an agency nurse into a small community. However, I think we're all aware that the people who are going to Stanton who need that care and that service are often from small communities. So, so you mentioned that one of the barriers to having more sort of practicum hours and training up here is the burden on staff who already experience significant burnout. But, part of that significant burnout and fatigue is due to so many hours spent training and mentoring temporary agency nurses. And so I wonder if there has been thought given to, maybe at Stanton specifically, and I understand it might be limited to specific wings or departments at Stanton. It's not every aspect of Stanton that has been bringing in agency nurses, but certain ones have been consistently bringing in agency nurses. And if there's been any analysis over the past 2 years of how much, you could deem it as sort of training hours, has already gone into these temporary staff coming in and out. And at the end of the day, we don't see anything as a result of that. Whereas at least if we devoted the same number of hours to an internationally educated nurse, at the end of the day, you would have someone who would more likely be living here and integrated into this community. At least at the end of all the training hours, you would have someone living and working here. So I just wonder if that lens or perspective has been put on this in terms of the amount of sort of training and mentoring we can afford to give international nurses in comparison to what we're already giving to agency nurses who often just sort of come and go and we never see them again. Thank you, Madam Chair.
Mm-hmm. Deputy Minister Duty?
Yes, thank you, Madam Chair, and I'm just going to a couple of comments before I refer this to Chief Nursing Officer Wazuda. So, I think one of the fundamental differences between agency nursing and the international educated nursing work that's ongoing is that agency nurses are already registered and able to practice their orientation to the north, I think, and the operations of the hospital are specific. And I don't actually have the details on the volume of agency nurses used. I did anecdotally hear a comment from someone yesterday that there's apparently 2 currently in the territory, but their time is up very shortly. So I know they're used, but I don't think they're used in a significant volume. But I don't want to say that because that's more of an NDHSA question, but I just wanted to put that out there. But I'll put the Chief Nursing Officer, Wazuda, can probably actually provide you a little bit more detail to answer your question. Thank you.
Okay, please proceed.
Yeah, thank you. Yeah, you pointed out a really important piece, that mentorship and support in situ on the floor at the time and dedicated resources. And that is one of the key pieces that we're really looking at. The challenge, of course, is the recruitment and the volume of nurses that are around, but we have seen success in that model, and it's happened on our OBS. At Stanton, they have dedicated education supports there, and we have heard the success that is at OBS. So what you're talking about is certainly something that we are looking at. The challenge is, of course, is that when we put someone in that position, that's an RN, and so we're effectively taking those hands off the floor for patient care, and they are supporting the education of others, but there's a bit of a, availability challenge in that piece as well. So these are things that we're specifically looking at, and why we really want to ensure that whatever resources we are dedicating to this makes sense for the volume. And of course, if there's a capacity to sort of, make it a part of someone's job already, things along those lines. But this is the type of creativity that I'm expecting to hear from the Territorial IEN working group, because the members of that working group are at that managerial and education specialty area. So I expect that I will get great recommendations from this working group that really has a finger on the pulse of what is something that we can actually do that we'll be successful in. So I'm really looking forward to hearing from that group, because I think you all will also, be happy with their creativity. The individuals that know then have the information are a part of that group. So thank you.
Thank you. MLA Morgan, do you have a follow-up question?
Yes, thank you, Madam Chair. So, acknowledging that agency nurses have been concentrated towards like a few areas at Stanton that have been hardest to retain or recruit for, is it even possible theoretically to adapt our rules around internationally educated nurses, but targeting just specific areas that are hardest to recruit and retain for, as opposed to saying, well, this applies to a nurse that can work anywhere in the territory? Is it even possible to have targeted sort of protocols if there's an internationally educated nurse that we're especially trying to recruit for that particular area? Then we would sort of make exceptions or say, okay, we can welcome you in and have a training program and have a sort of supervised practicum program for you, but not for this other area of nursing where we have less trouble recruiting for. Can you speak to that? Thank you, Madam Chair.
Deputy Minister Duty?
Yes, thank you, Madam Chair. I'm going to refer that to Chief Nursing Officer Wazuda, please.
Yes, please proceed.
Yeah, thank you. Yeah, those are the types of considerations that we would be looking at. When you talk about where the most difficult to recruit is, it's typically the most difficult to recruit are those highly specialized areas. And those aren't the gaps that we would expect IENs would slip right into. But what happens is that's typically the folks that go into those highly specialized areas are from more of our generalist type floors. So our med surg, our psychiatry, pediatrics, those folks, they would be the ones who would typically receive the work on or identify that they want to work in a specialized area, and then they would take that additional training. And so there are training programs that the health authorities have used for that internal laddering of skills that have been successful, and that's where I see IENs would really assist in filling the gap that those longer-term employees are moving out of, and that space they leave behind is where we would see the IENs kind of supporting those pieces. Thank you.
MLA McNeely, do you have a question?
Thank you, Madam Chair. I go back to the slide deck there, page number 7. And I would recommend, and I assume that, you're gonna come back here later, you completed the survey, so that information is there. Now you're gonna move ahead, you've got some results and recommendations. And please include the action plan from what you found out would be greatly appreciated as well. So I look forward to that discussion next year. Mussy.
Okay. Deputy Minister Duty?
Thank you, Madam Chair, and thank you for the comments. We look forward to bringing back our findings to the team with recommendations.
Okay, thank you. MLA McNeely, do you have a follow-up question?
No.
Okay. Okay. MLA Yakalaya, do you have a second round of questions to ask?
Yes, I do. Thank you. Are you looking to attract and retain IENs outside of the territory, or only ones that are currently in the NWT? Thank you.
Deputy Minister Duty?
Yes, Madam Chair, thank you very much for the question. So I think when the work is complete and we have a good understanding what the barriers and what the resources are, that will open doorways for us to consider how to attract maybe INs at a more general level, not just those in the territory. So I think once the work is complete, we'll know better on our pathway forward on that item.
Okay, thank you. MLA Yakalaya, do you have a follow-up question?
Yes, I do. Because right now, you look at it, I agree we need more nurses in all our regions. However, we have a housing issue. We need housing for these, for people to live in. If they are located outside of how do you plan to deal with the housing issue in the territory? Because we have in the small communities, we have limited, even no market housing. Is that something that's something you guys are gonna have to deal with? And is that something that you're looking at? Thank you.
Thank you. Deputy Minister Duty?
Yes, thank you, Madam Chair, and thank you very much for the comments. I think as the Minister stated last night in our briefing around the people strategy, it really has been a multi-departmental and health system review for the attraction and the retention of healthcare workers, and housing is certainly one of those. Everyone is really attuned to the housing challenges in the territory. So it is absolutely part of one of the factors that is being considered in all of our work. Thank you.
Thank you. And to retain and hire, we have different perspective in the small communities. And I know that recruiting from outside, I know our people would want us to train and educate our young people more to do these jobs. That's what I know that's the goal. That's what they want to see happening first. So, and housing is a challenge, just like what my colleague said. It's going to be a challenge to hire. So I know we talked about it, and I think there needs to be more education of looking after our own first. How can we get them to take on these I mean, we need more nurses, and that's what we've been crying for, and we've been asking for a long time. So it's just more of a comment that we have different perspective from the larger regional center to smaller communities, that we need to look after our young people first, educate them, train them more. So that's all. It's more of a comment. So with that in mind, I think I would like to say thank you for coming. Thank you for the presentation. Thank you for the presentation, and this concludes the public briefing on internationally educated nurse.